Hello, beautiful women. This is Karen, and I would like to present your next presentation, the birth of your baby. As usual, we have to go through the disclaimer. This series of presentations is designed to supplement advice given to you by your midwife and obstetrician, who are there to provide expert advice and support throughout your pregnancy. The Preparing for Birth Mothers background notes for prenatal classes written by Andrea Robinson for Birth International was used to formulate the presentations. These presentations cannot replace health professionals' advice and are only produced to provide a solid foundation of information which can be supplemented with your own knowledge and tools. The producer cannot take any responsibility for the use of this knowledge in any way, shape or form. The presentations are a gift to you to allow basic information to be disseminated to help manage pregnancy through your autonomous choice. Signs of impending labour. In the last weeks of pregnancy, you may notice some of the following signs that your body and the baby are getting ready for labour. The baby's head engages into the pelvis. This happens 2 to 6 weeks before labour begins, but may not happen until labour has started, especially if this is not your first baby. Braxton Hicks contractions, usually painless tightenings of the uterus, but occurring more often than in the early months of pregnancy, perhaps as sets of contractions. Increased mucus discharge from the vagina. Weight loss of around 500 grams to 1 kilogram in the week before labour begins due to a reduction of amniotic fluid around the baby. Baby may be less active as it runs out of space and also prepares for the labour to come. Spurt of energy in the mother, nesting behaviour. Slight diarrhea. Pelvic pressure due to the baby's position low in the pelvis. A show of pinky mucus discharge from the vagina, perhaps streaked with blood. Waters breaking with no subsequent labour contractions. How will you know you are in labour? Following some of the signs listed above, contractions will develop. These feel different from the Braxton Hicks contractions of pregnancy. Labour contractions have a rhythmic quality, with each one gradually building to a peak and then fading. Develop into a pattern of increasing intensity over time. The length of time between each one is less important than the length and strength of the contraction itself. Require concentration. You will not want to talk or continue with daily activities. We'll encourage you to find a comfortable position to ease the pain. Are strong enough that you will want to rest in between. Sometimes are felt as a constant minor backache with regular bouts of stronger back pain. Until the contractions are feeling like this, you are probably not in labour. Occasionally the membranes leak or break, about 10 to 15% of labours. Contractions may start immediately, but often they take hours or even days to become established. Once the symptoms described above are present, you will know that labour truly has begun, and until then you should carry on as usual with your daily life. When to go to hospital. During the first part of labour, you will be most comfortable at home in a familiar environment where you can make yourself comfortable. As the contractions become more productive, they will begin to settle into a pattern. The best guide is the intensity and strength of contractions, is their length, and once they are lasting 60 seconds or more, dilatation will be occurring. You will know when you feel you need to go to hospital, and as soon as you no longer feel comfortable in your own home, then you should ask your partner to take you. It is wise to stay at home as long as possible to avoid many unnecessary hours in the hospital, especially if this is your first baby. You may be more comfortable travelling on hands and knees on the back seat, or sitting on the back seat leaning forward onto the back of the passenger seat, if this can be pushed right forward. When you go to the hospital, go to the admission desk and complete the formalities. You will be shown to the labour ward by a staff member. If you are having a home birth, you will naturally stay at home and call the midwife when you want her to be with you. In the very unlikely event of a complication, your midwife will indicate when it is appropriate or necessary to go to the hospital. Admission into hospital. When you arrive in the labour ward, basic observations will be taken. Blood pressure, urine check, temperature, obstetric history, pregnancy history. The midwife will listen to the baby's heartbeat and feel its position in the abdomen. An internal examination will be made to assess progress. You can sit on a chair for these examinations, and your partner will be able to stay with you while they are done. Some hospitals have a policy of recording a 20 to 30 minute trace on the electronic fetal monitor as part of their admission procedure. There is no need to lie down for this. Sitting or standing is healthier for the baby, as it reduces the risk of jeopardizing the baby's blood supply from lying on your back. There is no research to prove that a benefit of birth outcome results from using routine electronic monitoring in labour. When these admission procedures are completed, you will be shown to your labour room or to the first stage area where you can make yourself comfortable. Sometimes labour can slow down when you get to the hospital and can even stop altogether. If this happens, it is your body's natural reaction to the change of environment. Give yourself time to adjust to the surroundings and the staff. Labour will re-establish when you are feeling comfortable. Alternatively, you might want to go home again, especially if you are in very early labour. The midwife will be able to tell you how dilated you are after she examines you. There is no need to speed up labour that has slowed in this way unless the baby shows clear signs of being distressed, which is rare. No matter where you choose to birth your baby, it will always be beautiful, and the best feeling that you ever have is to hold your baby for the first time. How long is labour? Every mother would like to know how long her labour will be. Unfortunately, it is impossible to anticipate how long labour will take, because each woman has her own individual way of giving birth. In general, giving birth to your first baby takes longer than giving birth to subsequent children, but each labour will still vary, and keeping an open mind will help you prepare for all eventualities. The average length of the first stage of labour with your first baby is from 12 to 14 hours, and for second stage from 1 to 2 hours. Labour and birth can take much longer than this and still be normal, and as long as mother and baby are in good health, the length of labour itself need be no cause for concern. With subsequent births, the average length of first stage is 6 to 8 hours, with second stage taking from 5 minutes to 1 hour to complete. Remember that your body knows how to give birth, just as your body knows how to grow the baby in the first place. Trust in your instincts and allow yourself time to explore the sensations you will feel. How long it will take depends on many factors, such as your comfort, emotional support, the position of the baby, the position you assume, and how you feel about becoming a mother. Having a baby is an adventure into the unknown, but one that is enormously rewarding. Be prepared to accept whatever your particular labour brings and allow yourself time to adjust and appreciate the powerful energy that is yours as you give birth. Making labour easier. In general, your body will work best if you feel safe and secure as you labour. This can be achieved through having the close, continuous support from your partner or close friends or relatives during labour. Having suitable support has been shown to shorten labours and reduce the need for pain-killing drugs. Finding a place to labour that is dark, quiet and cosy. The labour ward can be altered to provide these conditions. Dim the lights, keep the door closed and move the bed to give yourself more floor space for mats, beanbags and chairs, etc. Stay as vertical as you can to stimulate the labour and make the contractions more comfortable. Have regular drinks during labour and eat light snacks in the early stages. Stay focused on what you are doing and respond to our instinctive urges as necessary. This is the one time when you can be the complete centre of attention and your every wish will be readily fulfilled. It's really important not to become a victim of the pain cycle, which is a vicious circle of worsening pain resulting in epidural anesthesia requirement. So the pain cycle, you feel pain, which causes guarding, which causes muscle spasm and inflammation, restricted mobility, muscle weakness, loss of normal function, anger, frustration and helplessness, and negativity. Birth should be a positive experience, and by actually concentrating on relaxation, breathing exercises, massage, intimacy, partner coaching, healing music and Reiki will all help to alleviate any necessity of analgesia. However, if required, always accept antenatal and make a very careful decision about epidurals. Epidurals slow the pregnancy down, the labour down, and you don't have as much feeling or control, but at least your pain is reduced. So labour consists of several stages. You have the first stage, early labour. Cervical dilation is 0 to 4 centimetres. Accelerated labour, 4 to 8 centimetres. Transition is 8 to 10 centimetres. And then you go into the second stage, which is delivery of the baby, when the cervix is around 10 centimetres dilation. And then you have the third stage, which is the expulsion of the placenta. So the first stage, during this stage, the cervix dilates from closed to open, 0 to 10 centimetres. The baby moves down deeper into the pelvis and the face gradually turns towards the mother's back. Helping yourself. If you think that labour might be about to start, conserve your energy but keep on with your usual activities if it is daytime. If labour begins at night, try to rest or sleep. Take a shower, go for a walk, but don't get tired. Don't skip any meals, particularly if labour starts during the night or early in the morning. Have something light, nourishing and easily digested, such as scrambled eggs, tea and toast and soup. Pack the car with the things you might wish to take to hospital and also your labour goodie bag. Carry on with your usual routine until contractions become well established and you can be sure that labour really has begun. Contact your support people to alert them that your labour may be starting soon. If the waters break, note the colour of the fluid. It should be clear or milky white. If it is yellow, brown, green, then you should go to a hospital immediately, as this is a sign of possible fetal distress. If you begin labour before 37 weeks, you should go to the hospital straight away, as the baby may be born prematurely. Early labour. During this part of labour, the cervix softens, shortens, effaces, and begins to dilate. Helping yourself. Continue eating as long as you feel like it. Have regular drinks of juice or water, about 1 cupful every hour. Move around until you find a comfortable position. Stay relaxed and avoid fatigue, but continue light activities as long as you feel able. Take each contraction as it comes, deal with it, then rest up for the next one. Listen to your body and find ways of making it work easier and more comfortable. Empty your bladder every 1 to 2 hours during labour. Accelerated phase. As dilation reaches 4 to 5 centimetres, labour enters the accelerated phase. Contractions will be stronger, closer together, and will require concentration. You will feel the need to rest more between contractions. You will feel more introverted and focused on the activity within your body. Helping yourself. Conserve energy by finding positions where you can relax, fully supported, both during and between contractions. Keep drinking fluids, or if feeling nauseous, have sips of water or suck on ice chips. Have your support people provide massage or back rubs whenever you need them. In between contractions, ask support people for general massage, hot or cold packs, or anything else you need to stay comfortable and relaxed. If your feet are cold, put on your woolly socks. If you are offered medication, request an internal examination to determine progress before making a decision. A shower or bath at this time will help you stay relaxed. Keep changing positions until you are comfortable. Transition. Transition is normally the most difficult part of labour, as your body is changing over from the opening up phase to the bearing down phase, and contractions are usually very long, sometimes with double peaks and close together. It is a time of turbulent emotional feelings, and is often announced by sudden emotional change and feelings of being out of control. If the membranes haven't ruptured earlier, this will probably happen during transition, and the release of pressure may ease some of the discomfort. There may be an urge to push before the cervix is fully dilated. If pushing hurts at this time, then you should assume the knee to chest position until the cervix is fully retracted. Other symptoms of transition are shivering, cramps, nausea, vomiting, hiccups. You may feel pressure on your bowel as the baby's head moves deeper into the birth canal. Transition usually lasts from a few contractions to around 1.5 hours. Helping yourself. This is a very turbulent time for most women, and feelings of panic, loss of control, and annoying physical side effects are all common. The support of your partner will be vital at this time, and suggestions need to be explored. You will have difficulty being comfortable, but keep changing positions. It will be hard to stay relaxed, but concentrate on breathing as deeply as you can, making some noise with each out-breath to release the tension. A shower or bath at this time will give great pain relief, but if this is not available, use your hot, wet towels to provide local relief. Support people need to hold, cuddle, and reassure at this time. They need to keep distractions to a minimum and concentrate on helping you through each contraction as it comes. Ice chips or sips of water will help dry lips and nausea. Cool sponges on face and neck feel good. Avoid eye contact and keep your eyes closed to avoid distractions. If the urge to push is felt prematurely before dilatation is complete, move into the knee to chest position. Have pillows ready to lift your shoulders in between contractions. Reassurance and love are what you need most at this time. In summary, stage 1 has initial latent phase, then an active phase and a transition phase. And cervical effacement and dilatation during labour is something that you may hear of. So number 1, cervix is not effaced or dilated. 2, cervix is 50% effaced and not dilated. Cervix is 100% effaced and dilated to 3 centimetres, and cervix is fully dilated to 10 centimetres, which will then result in the transition phase into the second phase of labour and delivery of the baby. The second stage begins when the urge to push is felt. Sometimes there may be a lull between the end of the first stage and the first feelings of needing to push. If this lull occurs, take the opportunity for a rest until contractions re-establish strongly. This break from contractions may last up to 30 minutes or more. Contractions in second stage are usually shorter than in transition and more spaced apart, with time to rest in between. Second stage can last up to 2 hours or more with a first birth. Subsequent births are much shorter and stronger, usually about half an hour for second stage. The urge to bear down is usually irresistible. With each pushing action, the baby moves down the birth canal. Pressure will be felt on the bowel as the head presses on the rectum. As the head presses on the perineum and the vaginal tissues open out, a burning sensation will develop as the skin stretches to its maximum. This is a signal to push gently as the baby's head crowns, or allow a gradual stretching and easing of the skin over the baby's face. Once the head is born, it turns to one side to line up with the shoulders. The shoulders are born one at a time and the baby's body slips out. Helping yourself. Once the second stage begins, the turbulent feelings of transition will pass and you will notice renewed energy, your second wind. Pushing usually feels quite satisfying as you work with your body, and excitement is high as the moment of birth approaches. The uterus will dictate when and how much to push. You need to listen to these messages from within and concentrate on letting your body open up. Find a comfortable position for pushing with your body upright and the sacrum free to move. In between contractions, you can stand, kneel, or flop forwards onto hands and knees. As you feel the burning sensation developing, crowning, concentrate on easing the baby out slowly. The burning sensation lasts less than a minute and will soon pass. Put your hand down to feel the top of the baby's head emerging from your vagina. In between contractions, rest completely and keep sipping water. Third stage of labour. Once the baby is born, the cord usually stops pulsating within a few minutes. It can be clamped and cut either then or after the placenta has been born. Delayed cord clamping is very beneficial for the baby. Meanwhile, the uterus shrinks in size and continues to contract, a process helped by the baby nuzzling or sucking at the breast, skin to skin. The placenta begins to peel off the uterine wall and, when free, slides into the vagina. Very gentle pulling on the cord will help it out, together with some pushes by the mother. The placenta is usually delivered after about 20 minutes. The placenta and membranes are examined to make sure they are complete and that no pieces have been trapped in the uterus. The perineum is inspected to check for any grazes or tears that may need a stitch. If an episiotomy has been performed, then this will be repaired. The baby is given to the mother to hold and the family left together to get to know their new baby. During the first hour, the baby will usually show signs of wanting to nurse at the breast. Encouraging the baby to suckle will help establish lactation and the sucking reflex in the baby, as well as helping the uterus to stay firmly contracted, important for preventing excessive bleeding. Helping yourself, sit up while you are waiting for the placenta to come. This will help you see and hold the baby and facilitate latching onto the nipple. Skin-to-skin contact between you and the baby will help keep the baby warm, provide nipple stimulation and enhance the closeness. If you require stitches, you will be offered a local anaesthetic if you have not already received this in preparation for an episiotomy. You may find using the mask helps to relieve the pain of the anaesthetic injection. Something to consider is eating the placenta, ingesting the placenta after birth. So the benefits include increased milk supply, it balances hormones, wards off postpartum depression, replenishes depleted iron, increases energy level, assists uterus to return to pre-pregnancy state, reduces postnatal bleeding, speeds up recovery time. It can be actually made into capsules, or you can cut little bits off and put it in your blender with a berry smoothie. Very nutritious. Emergency birth at home. What should you do if the baby arrives before you reach hospital or before your midwife arrives? Emergency birth at home. A very small proportion of women have a totally painless first stage of labour or experience mild contractions and are unaware that anything is happening until they feel the urge to push, which is likely to be interpreted as a need to empty the bowel. Usually the waters will break at this time, which will alert you to the fact that this is the baby arriving. Don't panic, the baby is going to arrive at home. If you do happen to be alone, phone your partner and anyone else who is to be with you. Summon a neighbour or phone for an ambulance. Go to a convenient place that is warm and quiet. The bathroom is ideal. Get into a comfortable position with towels beneath you and allow the baby to be born as slowly as possible. Breathe the baby out. Wipe any mucus from the baby's nose and mouth. The baby will probably cry straight away, but if not, lie the baby on its side on the towels and massage the body firmly towards the head. Flicking the soles of the feet may also stimulate a cry. It is important to keep the baby warm. Wrap in a towel straight away and wait for the placenta. Put the baby to the breast if possible. Skin to skin is really important, and the triangle of your chest in between your breasts is the best incubator that there is. There is no need to cut the cord. When the placenta arrives, wrap it in a plastic bag and place it with the baby. Phone the hospital and tell the midwife what has happened. When you are ready, make your way to the hospital where the baby's cord will be cut and any tears will be repaired. Home birthing and birthing in general is fairly safe, but pregnant women can die of pre-existing medical conditions exacerbated by pregnancy, such as diabetes, malaria, HIV and obesity. Very rarely 3% have blood clots, 8% have abortion complications, 9% obstructed labour and other direct causes. However, 27% have severe bleeding, and the easiest way to actually prevent that is to suckle the infant on the breast immediately after being born, which will stimulate contractions and prevent any bleeding. 14% may die of pregnancy-induced high blood pressure, and 11% of infections, mostly after childbirth. However, this is all people in the world, including third world countries. So Australia has very, very safe births, and mothers are very, very healthy in Australia. So providing you look after yourself and you go to your antenatal care appointments and things like that, the chances of actually having any complications are a lot less these days. We know so much more about home birthing and natural birthing that there's not that many complications. It's probably like 3% are complicated pregnancies, so it's not much, but you always need to maintain contact with the midwife and obstetrician that's taking care of you. So there's a magic 4 T's and an O to do with preventing severe bleeding or complications postnatally. So thrombin could be pre-eclampsia, placental abruption, pyrexia in labour, bleeding disorders, haemophilia, anticoagulation, von Willebrand disease. Tissue, retained placenta, placenta accreta, retained products of conception. Tone, placenta previa, overdistension of the uterus, multiple pregnancies, polyhydramnios, macrosomia, uterine relaxants, and previous postpartum hemorrhage. Trauma, caesarean section, episiotomy, macrosomia greater than 4 kilos baby. And other, Asian ethnicity, anemia, induction, body mass index of greater than 35, prolonged labour, and age. So, but most people don't have any problems at all. It's 3% of pregnancies have complications. So let's hope that every one of you has a healthy pregnancy and a healthy birthing of a beautiful baby. So low-risk women who plan home births have fewer interventions without an increase in risk to mothers or babies. But remember, to have a home birth, you should actually have 2 midwives with you. So your main midwife will organise one of her colleagues to attend the birth, and you should also be in a less than 40-kilometre radius to the nearest hospital which can manage birthing. Some births do end up with caesarean sections for both the safety of the mother and the baby, but a little forward planning and continual support with antenatal visits will actually eliminate most of the chances of having caesareans. But a caesarean, it's just like any other operation, but it does take a while to recover from, and ideally it would be nice if everyone was able to have a natural birth, but sometimes it's better to actually have a caesarean and have a live mother and a live baby rather than losing either one. That would be horrible, and I never really want to see that happen. Another thing that people worry about is the cord around the baby's neck. It is very rare for the cord to be so tight that it stops the baby from being born. However, if the baby is not born within the next contraction after the head is out, feel around the baby's neck to see if there is a loop of cord. A loose loop can be gently eased over the head. There may even be 2 loops. If very tightly around the neck, the cord may have to be cut to allow the birth to proceed. Tie 2 lengths of sewing tape, nothing very narrow, tightly around the cord, and with clean scissors dipped in Dettol or methylated spirits, cut in between the two ties, unwrap the cord from around the neck. The rest of the baby can now be born. Make sure there is no bleeding from the cut ends. Because this rare emergency could arise, it is suggested that an emergency pack consisting of 2 clean lengths of tape and a pair of scissors be kept wrapped in a clean plastic bag in the bedroom. It should be put in the car when going to the hospital. So previously, cord prolapse was thought as very serious with compromise of the fetal circulation. However, it's actually really hard and rubbery and very difficult to cut. So when you're actually trying to cut it, it's like rubber, and the actual blood supply is in the center of the cord. So it's really just only the obstruction of labor that is the problem. So you can have 3 types of cord prolapse. You can have a occult hidden prolapse. The cord is compressed between the fetal presenting part and the pelvis, but cannot be seen or felt during vaginal examination. The cord is prolapsed in front of the fetal head. The cord cannot be seen, but can probably be felt as a pulsating mass during vaginal examination. And a complete cord prolapse, the cord can be seen protruding from the vagina. There are many ways of increasing your comfort during labour. Making preparations in advance will increase your confidence in being able to help yourself and enable you to take care of your own needs without having to rely on the hospital staff. Being well equipped and knowledgeable about self-help strategies will also reduce your need for pain-killing drugs. Your goodie bag. Here are some suggestions for items to include in your goodie bag. All have proven useful for women in labour. Consider each one and make your own list. Add any extras of your own. Ways they can be used. An old t-shirt or loose top to wear, several pairs of panties and some sanitary pads to catch leaking fluid, dressing gown and slippers for walking around the labour ward, your own pillow, the doona from your bed, aromatherapy oil burner, electric for creating a relaxing environment, shower hat to keep hair dry under the shower, fruit juice to drink every hour during labour, glucose lollies to suck for extra energy, vegetable oil for massage. Aromatherapy oils such as lavender are a nice addition. Face cloths for wiping sweaty foreheads, warm socks, feet get very cold in labour, lip chapstick for dry lips, 4 hand towels, rubber gloves and bucket to make hot towels for relief of pain anywhere. The gloves should be large enough for the support person to wear. Use the bucket to carry everything on your goodie bag list. Tennis balls provide firm local pressure. Food and drinks for your support people to keep their energy up. Swimsuit or change of clothes for your support person for use in the shower. Tape recorder, earphones and music tapes to help you relax. Camera to record the event. Positions for labour, first stage. Experiment with different positions to find the ones that feel most comfortable, and be prepared to try them all again when labour is underway. In choosing the most comfortable position, remember the woman should be as fully supported as possible using people, pillows, bean bags or furniture to allow her to fully relax. Knees should be bent to avoid tiredness in the legs and to make pelvic rocking easier. Her feet should be apart to give a wide base for support and to encourage open positions. Be creative in your adaptation of available furniture in the hospital. If you need extra pillows or a stool or chair, request these. Once a comfortable position is found, use it until she signals that it is no longer helping her relax. Change positions only as she indicates, unless you are positioning for a specific purpose, such as to help the baby turn from posterior or to encourage the baby to move down further into the pelvis. Using water and heat. Warm water is very soothing in labour and effective at easing pain. Showers are quickly available, provide freedom of movement, can be as hot as required, and have a spray that can be localised to particular sore spots. Handheld showers work best. Deep baths or pools take time to fill and must be no hotter than 37 degrees Celsius. They provide freedom of movement if large enough, enable a deep sense of calm which can lower anxiety and pain. They are safe to use after the membranes have broken, and water baths are safe for the baby. Using hand towels wrung out in hot water and applied to local sore areas are very effective for relieving pain and provide a good alternative if a shower or bath is not available. A fresh towel will need to be applied for every contraction. Use a bucket of very hot water to heat the towels and use rubber gloves when wringing them out. Hot packs can be made from small cloth bags of grain such as wheat or rice. Heat in a microwave after dampening the fabric cover. Alternatively, gel-filled plastic packs heated in near boiling water work well. Apply the hot pack to areas of localized pain. Using technology. Staying mobile while using technology. If technology such as an electronic fetal monitor becomes necessary during labour, it is still possible to stay upright and mobile while it is in place. If you use pain medication, some positions may be more difficult to achieve, especially if you have limited use of your legs. Another thing that is useful is a TENS machine for pain relief in labour. The brain receives the labour TENS stimulation over pain signals. Labour TENS stimulates the nerve fibres in the spinal cord, and the pain signals are sent to the brain via the spinal cord. Pain signals are blocked by the TENS stimulation and cannot reach the brain. A telemetry unit uses a radio beam to transmit the readings from an electronic fetal monitor to a centralised recording machine. This removes the need for direct attachment to the monitor and enables greater freedom of movement. And remember, you can ask the midwife to check the dilation of your cervix when you are in most positions. It is not necessary to lie down for this procedure. Standing or sitting in the shower will help ease much of the pain, especially towards the end of the first stage. Lying or kneeling in a bath or pool encourages faster dilation. Use well wrung out hot wet towels draped over the buttocks for lower back pain. So positions for labour second stage. In second stage, a woman needs to be able to brace her body to push effectively. She will seek something to grip and will prefer to be upright and her legs planted firmly on a floor mat and good support from her partner or other helpers. Furniture can also be used as a source of support. A mirror is useful to enable the father and caregivers to see the baby's progress towards birth. Women usually have their eyes tightly closed at this time. Sitting on the toilet often helps early pushing contractions become more coordinated. And leaning against a wall makes it easier to support a woman in a deep squat. Leaning forwards helps reduce the effects of gravity during birth. This is useful if the labour is very fast. A birth stool can be comfortable support during the birth. So lots of different positions that you can actually get in, and just keep experimenting and moving around, because when you're moving it actually relaxes your muscles as well. So moving, breathing and being with your partner is fantastic for pain medication, or rather than pain medication. That brings us to the end of presentation 2. The next presentation will be obstetric interventions explained. Just remember that birthing doesn't have to be painful, especially if you choose hypnobirthing, calm birth, water birth, and just being really well prepared for the big day. Look forward to presenting further information for you. Take care and love yourself and love your baby.